Welcome to the Deep Dive. We cut through the noise, getting straight to the insights that really matter. And today we've got a really critical topic, one that touches everyone. You probably remember the headlines from earlier this year, right? Those major cyber attacks. Just healthcare providers like Ascension, Change Healthcare, groups like Black Basta, Black Cat LPHV. These weren't just, data breaches. They were massive operational shutdowns. We're talking billions in losses, widespread service interruptions, stuff that directly hit patients. It was a pretty stark wake-up call, I think, about how fragile our healthcare infrastructure can be. So for this deep dive, our mission is pretty clear. We're exploring the current state of medical device cybersecurity vulnerabilities. Looking at 2025, our aim is basically to give you a concise, well-informed view on this absolutely crucial area. It keeps changing too.
Exactly. And we're doing that by digging into a comprehensive new report. It's the RunSafe Security 2025 Medical Device Cybersecurity Index. They surveyed healthcare execs across the U.S., U.K., Germany, and it paints a really clear picture. We're going to unpack what they identified as the top 7 medical device vulnerabilities. We'll explain what they actually mean and, why they should matter to all of us.
Yeah, because these aren't just abstract tech problems, are they? They directly impact, the quality of patient care you receive, how fast you get diagnosed, how effective treatment is, and ultimately your trust in the systems meant to keep us healthy. So let's get right into it.
Okay, so the report kicks off with a pretty concerning trend. Medical device software vulnerabilities, they're definitely on the rise, no question. And this is creating significant, sometimes dangerous, exposure for hospitals, for healthcare networks. It's kind of a perfect storm, really. You've got outdated software on critical machines, on insecure connections, linking everything up, and this just explosion of Internet of Medical Things devices, IoMT. Right. And what's concerning is how all those factors kind of converge. They basically make medical devices, ripe for exploitation, easy targets. And this top 7 list, it's not just a random collection of issues. These are the weaknesses really shaking the landscape right now in 2025. Understanding them isn't just, technical awareness. It's about seeing where the real systemic risks are hiding.
Okay, that definitely sets the stage. So let's dive into those specific risks then. We'll break down each one, what it is, and the real threats it poses. All right, kicking us off, malware infections. This was identified as the most widespread vulnerability. A staggering 51% of organizations reported this, half of them. And we're not just talking about a standard computer virus here. This is malicious software, often purpose-built to infiltrate and disrupt specific medical devices. These can be highly targeted campaigns. Think about, say, a radiology department. Malware can actually force them to take entire imaging systems offline. Your MRI, your CT machines just down. That means diagnostic delays, patients waiting, critical information just got stalled. And in some really brutal cases, malware has been used to just wipe the device firmware or corrupt system files, requiring a full reinstall before those vital machines can even be used again.
Yeah, and the real insight there isn't just that a device is down, it's the operational triage that follows. When critical devices like, say, ventilators or infusion pumps get quarantined, it doesn't just affect that single machine. Entire treatment pathways are immediately delayed or halted altogether. Suddenly, patient care decisions are being dictated by a cyber attack outage. It forces clinical teams into this difficult resource allocation game where time is, often life or death. Beyond that, direct malware, another big threat is network intrusions. Nearly half, 44% of organizations experience these. And these are particularly insidious because they often go undetected for quite a while, extended periods. Attackers get unauthorized access, maybe through poorly segmented networks, or using default credentials that frankly should have been changed ages ago, or exploiting outdated communication protocols. So imagine adversaries, maybe they've already breached a hospital's general IT system, right? Then they quietly pivot. Move sideways into the clinical device networks. Suddenly they have visibility, maybe even direct control, over networked equipment, patient monitors, infusion pumps. They might install backdoors or subtly manipulate how a device functions, all while flying under the radar.
So how do these network intrusions differ from, say, what we usually hear about with corporate breaches? It feels different. It sounds like these intrusions create these silent footholds that just persist for a long time, allowing for maybe long-term compromise or subtle manipulation. What makes them so hard to spot then?
Exactly. That's the key difference. Unlike typical IT breaches focused on, grabbing files and getting out quick, these intrusions are often designed for longevity. persistence. They establish a presence, allowing for reconnaissance maybe, or the ability to strike later at a more critical time. And they're tough to spot because they often mimic legitimate network traffic, or they exploit authorized access points that have been compromised, maybe a vendor account. It's a much more insidious threat, less about immediate theft, more about long-term control.
Right. Okay. That leads us neatly into the third critical challenge, ransomware targeting device operations. This is reported by 37% of organizations. And this isn't just about encrypting data and demanding money, though that happens too. These campaigns are specifically designed to disrupt the availability of the device itself, making it unusable. So picture this. Ransomware locking operators out of critical MRI or CT machines. Diagnostics, just stop, dead halt. Or, even more critically, ransomware hitting infusion pumps. Surgical robots, forcing the suspension of treatment procedures entirely. The actual physical tools of healing, the instruments designed to save lives, are suddenly rendered useless by code.
And what's really crucial to understand here is the attacker's intent. They figured out that denying access to these critical tools is the ultimate pressure point. It's far more impactful often than just encrypting patient data. They understand that in a hospital setting, denying access to a life-saving device puts immense immediate pressure on the providers. Makes them much more likely to pay the ransom, right? This isn't just a business interruption, it's a direct threat to patient safety, leveraging the essential nature of device availability. Okay, our fourth vulnerability, remote access exploitation. This hit 28% of organizations. Now, remote access is absolutely vital, right? For servicing medical devices, running diagnostics, software updates. It's a necessary convenience. But unfortunately, it's also become a primary entry point for attackers. This usually happens through things like unsecured remote desktop sessions, maybe weak VPN setups, or vendor accounts that just have way too many privileges. A common scenario the report highlights involves attackers getting hold of default or maybe reused credentials for remote maintenance tools. If an attacker gets these, they gain the exact same level of control as an authorized technician. And from there, well, they can move laterally across device networks, they can alter system settings, deploy malware, all without ever needing to physically be inside the building.
Wow. So remote access, which is like a lifeline for maintenance, has become this really serious vulnerability.
Yeah.
What's the trickiest part of securing those connections? What might surprise people? Is it just patching or is it deeper?
It's often deeper, and it boils down to inherited trust, really. Many remote access solutions, especially the ones vendors set up for support, they often come with pre-configured access, or trust relationships that kind of bypass the hospital's own internal security checks. Attackers know this. They exploit this inherited trust. They're essentially using the vendor's keys to unlock the hospital's devices, and that makes it much harder to secure than just an internal system, because you're also relying on the security practices of, well, a third party.
Inherited trust. That makes sense. Okay, turn into point 5. Supply chain compromises. Get this. 1 in 4, 26% of organizations trace compromises back to third-party software or libraries or even hardware components embedded in their devices. So this means vulnerabilities are being introduced way before the devices even land in a hospital. We've seen this outside healthcare, right? Like the SolarWinds attack. Big news. Now imagine that same idea applied to the medical world. Attackers injecting malicious code into, say, firmware or software updates distributed by a trusted medical vendor. Then when those updates get pushed out across multiple healthcare systems, every single customer organization inherits that vulnerability without even knowing it. They become compromised by proxy.
Yeah, and a key insight here is just the sheer scale of the impact, because these compromises are embedded upstream in the supply chain. They can affect thousands, potentially tens of thousands of devices across countless healthcare systems all at once. That makes them incredibly challenging to contain. And, maybe more profoundly, it makes it hard to restore trust in the integrity of essential medical tech. It's suddenly not just about securing your own network anymore. It's about the security posture of every single partner in your supply chain. Okay, next up, number 6, vendor-identified vulnerabilities requiring updates. Nearly a quarter, 24%, reported facing critical vulnerabilities disclosed by their device vendors. Now look, transparency from vendors is good, right? We want them to disclose these things. But patching medical devices poses really unique challenges compared to, say, patching your laptop or a server. These devices often need significant downtime for testing, for validation, before you can even apply an update. And in highly regulated environments, some patches might actually trigger entire recertification processes, adding layers of complexity and time. Think about an imaging device firmware update. Once installed, maybe it conflicts with existing calibration protocols. You can't just put that device back into service immediately. No way. It has to be fully retested, recalibrated, made sure it's safe and accurate again. This is a significant hurdle, and attackers are acutely aware of it.
So even if the fixes exist, this slow, disruptive patching process. It sounds like it just leaves these systems wide open for potentially long periods. It sounds like a real catch-22 for hospitals. What's the core tension there? Is it safety versus security?
That's exactly it. The irony is that the very regulatory frameworks designed to ensure patient safety and device efficacy can inadvertently create these prolonged windows of vulnerability. Hospitals are forced into this tough choice: prioritize immediate patient care needs or prioritize timely security updates, knowing that applying a patch could temporarily disrupt a critical device, maybe take it offline, or require extensive revalidation later. And attackers, they ruthlessly exploit this dilemma. They target devices precisely during these known maintenance windows of delayed patching.
Wow. Okay, finally, our seventh critical risk. Data exfiltration from devices. Nearly 1 in 4, 23%, reported actual data theft directly from medical devices. And these devices, they often process incredibly sensitive patient information, right? Imaging results, diagnostic data, treatment histories, all of it. We're talking about scenarios like compromised cardiology devices leaking continuous heart monitoring data, or imaging systems being used to siphon off thousands of patient scans. The report points out that in some attacks, this stolen data is then packaged up and sold on underground markets, meaning patient health information is literally being monetized by criminals.
And the broader implication here is the powerful economic incentive for attackers. Medical records, with all that rich personal and health data, they often fetch much higher prices on underground markets than, say, credit card numbers. Why? Because they can be used for really sophisticated identity theft, insurance fraud, often for years after the theft. This makes medical devices, which hold this data, prime targets for adversaries specifically looking to monetize sensitive information, turning our health data into, well, a commodity.
So, given all these vulnerabilities, these 7 risks, which devices are cyber criminals actually hitting most often, successfully targeting? The report is pretty clear. They're going after the absolute backbone of patient care. These are the systems that healthcare providers depend on most day in, day out for diagnosis, treatment, monitoring. The top targets include imaging systems, things like CT, MRI, X-ray machines, targeted in 41% of cases. Huge number. Patient monitoring devices essential for ICU, emergency care, that's 40%, laboratory and diagnostic equipment core to figuring out what's wrong, 34%, infusion pumps delivering life-sustaining medication, 23%, network surgical equipment used right there in the operating room, 19%. And even implantable devices like pacemakers, insulin pumps also targeted in 19% of cases.
Yeah, what's startling when you see that list is these aren't peripheral systems, are they? These are the absolute heart of how modern healthcare is delivered. An attack on any one of these can have immediate and potentially devastating consequences for patients. So when you combine the vulnerabilities we just walked through with the critical nature of these specific devices, you really grasp the immense stakes involved here.
Right. So let's shift focus just a bit now. Why does all this matter so much for the medical device manufacturers themselves? The landscape in 2025, based on this report, makes one thing crystal clear. Medical devices are now absolutely central to the cybersecurity conversation. From malware and ransomware disrupting operations to these supply chain compromises, attackers are finding multiple ways in, exploiting weaknesses that directly affect device reliability and, maybe most importantly, trust in the product itself.
Absolutely. The implications for manufacturers are really significant now. Healthcare providers, regulators, even the procurement teams deciding which devices to buy. They are all scrutinizing device cybersecurity much more closely than ever before. These vulnerabilities aren't just seen as isolated technical flaws anymore. They're viewed as direct risks. Risks to product adoption, risks to meeting increasingly strict regulations, and ultimately risks to long-term market success. Manufacturers simply have to prioritize security now, in design, in testing, in their whole investment strategy, if they want to stay competitive and, frankly, relevant.
Okay, so as we wrap up this deep dive, the core message seems pretty stark. Medical device cybersecurity isn't just a niche concern for the IT folks anymore.
Yeah.
Not at all. It's fundamental. It's deeply integrated into healthcare itself, affecting everything from, your routine checkup and getting a diagnosis to life-sustaining treatments and long-term care. It's everywhere.
And understanding these 7 critical vulnerabilities we've discussed, it provides a crucial roadmap. It shows where security efforts are likely to have the greatest impact. For manufacturers, it's about strengthening their products, sure, but also truly differentiating themselves. In a market where resilience is rapidly becoming not just a feature, but a baseline requirement, a key competitive advantage. Which, raises an important question for you, our listener, to think about. As our healthcare system gets ever more connected, more reliant on all these smart devices, how do we make sure that the very technology designed to heal us, doesn't somehow become our greatest vulnerability? And maybe just as importantly, what role do you think building and maintaining trust plays in this whole evolving landscape?
That is a powerful thought to consider. Definitely something to mull over. We really encourage you to keep exploring this vital topic and its profound implications for the future of healthcare. Thanks for joining us on this deep dive.